So which of the following structures is most likely affected in this patient's condition? So then we have, this looks like an anatomy question, a bunch of anatomical answer choices. So we have a 45-year-old woman presents to a primary care physician after a 2-month history of heel pain, particularly during the first few steps after getting out of bed in the morning. She's overweight, sedentary lifestyle. Physical examination, there's tenderness at the medial tubercle of the calcaneus, so that inside part. Which of the following structures is most likely affected? Let's see here. Yeah, immediately I want to jump to why things are wrong. Let me think why something would be right. Weirdly, I don't like a lot of these. Okay, this is where I'm sort of getting stuck in the thinking process because I just want to go cross things out as opposed to come up with something and why it's right.
So talk to me about your gut answer choice. Start with that first. Okay,
Okay.
what does your brain kind of lean towards? That might when I usually say a gut answer choice, the way I explain it scientifically is that with all the studying that you've done, your brain might not be able to pull it to the forefront of your mind, but there's kind of this subconscious you that like, oh yeah, I kind of remember something like that. That's why I'm leaning towards that. So what does your gut say?
Um, if it's first few steps, it's heel pain. It seems like a bursitis to me, like the calcanea bursa makes the most sense
Okay.
without going through this
Okay.
like super clearly. So Achilles tendon, I think, I mean, overweight, sedentary lifestyle, medial tubercle. I mean, Achilles tendon's going to be like a little more posterior. I don't like it for that reason. Um, the dorsal and plantar fascia are not really too near to the calcaneus, I don't think,
Okay.
for this
Okay.
purposes. And then posterior tibial tendon. So that tibia is going to be right on the inside there. Posterior tibial tendon maybe could be that as well. I'm not really too sure with
Okay.
this question. I'm not like super confident in calcanea bursa, but let's see.
Any reason for you to change it? That's my question to you here.
Um,
So if you change it, remember you gotta tell me exactly the reason why. You gotta force
exactly
yourself.
why.
Yep.
Mm, posterior tibial tendon. Oh wait, calcaneus is going to be that back part. I'm thinking. I'd just be thinking of the wrong thing. I'm thinking of like the posterior tibial tendon. And Achilles tendons. Okay. I mean, I'm not even sure if there is a calcaneo bursa. Overweight, sedentary. I don't know if that would cause a bursitis. 2 months. I mean, bursitis could be like nagging like that and annoying. Like if you snap an Achilles tendon, you're not going to be walking.
Right.
Um,
So if you have no
yeah, maybe
direct,
down to just
yeah, go
you
ahead.
have no direct reason to. Yeah, that's it. I don't really have any. I'm trying to like override it, and I'm not sure. I'm
All
not
right,
super confident in this answer, but
and that's okay. So I'm gonna tell you this, right?
okay,
So let's talk a little bit about this, okay?
okay,
So the way you work through this question, I think you worked through it beautifully. Okay, I know that sounds really weird.
okay,
Okay, the reason why is you followed all the steps, right? You might have gotten the answer wrong, but you followed the correct steps, right? Your thought process is good, and you didn't change it, right? You didn't change it in the fact that you're like, okay, I maybe think it's this, maybe think it's that. Okay, the reason why
okay,
is it's very very important that you continue to follow these steps because it's going to help you in the long run. Okay, you
okay,
have to tell yourself that this is how like it's kind of like the process, right? You got to do this process over and over and over again, right? And then you kind
okay,
of get the information after, right? But let's talk about this, right? Overweight, patient's age, sedentary, right? Worst of a couple of few steps, all consistent with plantar fasciitis, inflammation of plantar
hmm,
fascia, band that connects the heel bone to the toes, right? So at the very bottom, right? Tenderness at the
yep,
medial tubercle, the most common finder in plantar Achilles tendon,
okay,
that's in the very, very back of the heel, right? So that's going to be different, right? calcaneus bursa, which is between the Achilles tendon and the calcaneus, right? So it'll probably have very similar here at the back of the heel, right? Dorsal fascia is not kind of anywhere here, and
It's going to
then
be at the
posterior
top,
tibial
right, of
tunnel.
the foot.
Yep,
Okay.
right. And then this is going to be the inside, right? But yeah, so I was going to tell you something else. I'm trying to think of what else here. Yeah, so changing your answer without a good reason, right? That's going to open yourself up to a lot of incorrect answers in the long run. So you never want to, that's why I said you work through this thing pretty good, right? And the fact that you're not like, okay, let me just randomly change something, right? You want to always tell yourself there has to be a reason. So I always tell my students, if you can't explain to me why you chose that answer, then probably not a good reason to choose it. You know what I'm trying to say?
Okay.
Yep.
Okay.